So, you've got erectile dysfunction. It could be caused by anything. Let's assume it's just caused by things are slowing down, a little bit of anxiety or old age. Who knows? It doesn't matter. So it's not one specific medical problem is what I'm getting at. You have just general erectile dysfunction. Things aren't quite as good as they used to be. What are your choices? Generally, the medical approach in any aspect of treatment is we go from the least invasive to the most invasive. So, if you've got erectile dysfunction, we generally do start with the oral medications. We have 4 basic kinds of medication for erectile dysfunction. The most famous one and the first one was Viagra. That's also known as sildenafil in the generic form. Then we have Cialis. The generic version of that is tadalafil. Then we have Levitra, which is maybe not quite as well known, but that's a very good drug too. It's called vardenafil. The last drug is Stendra, and it is also called Avanafil. Now, the 4 drugs all require the same thing. They require good blood flow, good trapping mechanism to keep the penis full of blood. You need good nerves, and you also need sexual arousal without anxiety. Again, these drugs can help it if you're mildly anxious, but if you have real panic or you're having real anxiety, erectile dysfunction, your adrenaline will also shut off these drugs. Okay, you've probably seen, if you've been searching online, there are things called suppositories, there are creams, all those things. Folks, they just don't work. The next level of treatment is penile injections. Now wait, I know the thought of that is terrifying. I'm supposed to inject a needle in my dick. Okay, take a breath. It's not what you think. It's a tiny little needle, it's an insulin needle, injects in the base of the penis, and guess what? There are very few pain sensors in the penis. It just doesn't hurt. Most guys will use an auto-injector so you don't even see the needle. You just push a trigger, it sticks it in for you, you're done in 5 seconds. These drugs are basically for guys for whom the oral medications don't work. No, they are not liquid Viagra. I get that question all the time. These are vasodilators that work directly on the arteries in the penis and cause the penis to relax and fill with blood. Again, if you want to know how the penis works, that's for a different class. You can find it over there on the side of your screen. The injections are great because you determine the dose and then you determine how long you want it to last. A bigger dose results in a longer lasting erection. Most of the time we're looking for 45 minutes for an erection. Most guys don't have intercourse for much longer than that. However, if you're having a big party, okay, give yourself a big dose. You can have a 3 or 4 hour erection. If it goes on longer than that, please call your doctor. These are great for men who have nerve damage from diabetes or prostate surgery or just anything. Even if you are unconscious, these will give you an erection. In fact, there's a funny story how this was discovered. A surgeon in France accidentally injected this drug into the penis instead of the patient's muscle. I don't want to talk about the quality of his surgery, but they couldn't believe it. During the surgery, the guy got an erection. Let's just say that poor guy's surgery, that was probably not very good, changed the course of history. One ancillary treatment that is always useful for guys are cock rings. Now in the medical field we will call them constriction bands. However, everyone knows them as a cock ring. You're like, really? So what happens is a lot of guys can get an erection but they can't maintain it. So a cock ring around the penis and behind the scrotum often compresses the penis enough to trap the blood to maintain an erection. I figure most guys gain about 20%. So if you have a 75% erection, you use a cock ring, it'll get close to 95%. If you have a 50% erection, which might not be usable, using a cock ring can bump things up just enough to make them usable. It also gives guys a lot of confidence. Cock rings are also really good for premature ejaculation. They're just good because things feel different and it's fun. Your penis gets a little bigger, you get a little veinier and bulgier. But in addition to just the fun aspects, cock rings help with erections. Oh, be careful though. Cock rings can be complicated. I do not recommend the steel cock rings. Those, if something goes wrong, your penis gets hard, you get locked down, the blood can't get out because the steel ring is holding it. Guess what? You end up in the emergency room and they have to call the fire department to come and cut it off. The cock ring is, not your penis. I really recommend starting off with the super stretchy rubber or silicone cock rings. You can get them in any sex shop. You can get them online for that matter. We're talking something that costs less than $10. Don't use rubber bands. Don't use twist ties. Don't use string. Don't use anything like that around the house. Okay, so if you've been using the pills, they don't work. You're using the injections and they no longer work. The final thing sounds scary, but it is really not. I talk about this now because I don't want you to think that at the end of the line there's this abysmal cliff of pain and despair that you fall into. The next treatment is a penile implant. I know it sounds crazy. We're going to talk about it in more detail, but the fact is 96% of men who have an implant love it. It's considered to be the only cure for erectile dysfunction. Basically, how an implant works is it's 2 water balloons in your penis. There's a pump in your scrotum. You squeeze the pump, the water goes into the water balloons, you get an erection. It's an erection anytime you want, anywhere you want, for as long as you want. It's amazing how it works. It looks just as normal as any other erection. You can be in the locker room, nobody will know that you have an implant. They are an amazing invention. Yes, orgasm's the same, ejaculation is the same. The youngest patient I ever had who got an implant was 19 years old. They are a wonderful final solution. But granted, every guy's not ready to run to those right away. We start with the pills, we do the injections, and then we go to the implants. But guess what? The number one complaint of every guy who has an implant is they waited too long.